So we are at the Department of Biomedical Informatics at Columbia University. Your question was which disease I want to cure, right? Well, my work is more general than that, although at the moment I am working with a community that is patients with diabetes. So my work is situated in online health communities. More particularly, I'm interested in the forums in online health communities. I'm working on a phenomenon called sense making, which basically investigates how people collectively build knowledge around problems, and then also how people use the community as a group, as a resource to find answers to their problems. I'm interested in developing tools that will help people comprehend better the discussions, the content of the forum, enable them to share knowledge in an easier way. So they come there and they talk about their treatment, different types of treatments, medications, breakthroughs in science. They share personal experiences. They come to those forums to find information so that they can learn from that and apply it to how they treat their disease and how they think about their disease. So I'm kind of trying to do that improvement. I come from Macedonia, geographically, but professionally, I have a computer science and engineering background. I think my interests in science date way back in my childhood. As long as I remember, my parents say I was a very curious kid. I was asking questions for everything. I would say that the first phenomenon that got me intrigued was ball. Right? I was very intrigued by ball movement. I was impressed by the way you apply force in different parts of the ball and it goes differently. How can we predict that? Those were the questions that I was asking myself when I was like, I don't know, 9, 10 years old. So before I came to the US, while I was doing my master's thesis and while I was doing my undergrad, I used to play basketball. 5 of those years, which were 8 in total, I played in the Premier League, which is professional level. I can say that was a very hard and busy time in my life. Being forced to plan every single minute of your day to be able to complete your tasks on time was a great challenge and required a lot of discipline. At the moment, I didn't appreciate it as much as I do it now, because the lessons learned in that period I apply in this new PhD environment. Every finding that you have, every intervention, informatics intervention that you build, has an impact on hundreds, thousands, sometimes even millions of people. That will give people much clearer insight into the spectrum of solutions of the problem. That way they can get educated about the disease that they have in a much better, much efficient way. That can, for example, affect how they interact with their physician, how they self-manage their disease. Ultimately, that can affect positively their health. So I think that's the driving motive for me, helping people basically, applying my skills to help others. I have to have strong evidence to show that what I'm doing actually positively affects people's health, quality of life. Or even show that some proxies related to health outcomes are positively improved. Now, once those 2 things are in place, I can say that my work will basically change the paradigm of how people perceive forums as platforms, and then how they look at them as a repository of information and knowledge.
See the keywords and who posted it.
So far, I've done a prototype of a discussion visualization tool. The intention of the tool was to help people to comprehend the discussion in a better way. So we tested that tool with people from the community that I'm working on with 2 diabetes, and it was shown that the accuracy of the answers was improved by 60%, and we found statistical significance for that. But these findings are telling us that there is big room for improvement in this area. You have an ocean of information that are defragmented and and I have to be able to, to tease out what's useful, what's not. So I'm like a sculptor, right? So it's very interesting. Right now, as we can see in the world, things are getting more and more connected. People are getting more and more connected. It's about teamwork. It's about collaboration. It's about doing things together. I didn't mention this, but in the forum we have more than 30,000 members. So that's a lot of people. And thinking about how they come together to create knowledge is fascinating. Everybody has to use his skills to help others. The world needs help. People generate problems. That's what we do, right? Life implies generating problems, and life requires solving those problems, And the feeling of being responsible for finding those solutions and helping others is the most valuable thing you can experience in life. So, science gives you a chance to find those problems that are not so obvious and find complete solutions that can be replicated by others, that can be used further to develop products that will improve people's life on a large scale. So we are talking about fundamentally changing the world. So if that's not enough, I don't know what else is.